At the center of this, at the core of this really is research. As a researcher, we are preoccupied with finding solutions. We are preoccupied with finding the missing link between the cause and the effect, between the driver and the outcome of any health condition that we could be researching in. In mental health, we are looking at understanding the issue better, and therefore, as we have seen in the previous slide, intervening at the right time, targeting the right people in terms of beneficiary for interventions, and designing programs that are not just effective, but should also be culturally sensitive, that takes into consideration the environments in which they are being implemented, and the policy environment as well in regarding other supportive services or products that could be required to improve the mental health of people. So research is mainly, especially in mental health, and it's not very different from other areas of research. We can generally classify research approaches in mental health in three classes, and this really is elements of epidemiology. I would invite you to look, to read about this if this sounds new to you, on the different ways of designing projects, depending on the research question that we're interested in. But case studies really will utilize a lot of socio-demographic or bibliographic information for individuals. They are a very good way of generating hypotheses when something is not clear, when you do not know what causes what, when you really want to understand the genesis of something and how it progresses to becoming something bigger, or the pathways through which something happens, then it's important that you perhaps start by designing a case study, working with few numbers, perhaps even one case in the condition that you're interested in, and diving deeper to understand very well what the issue is all about and how it progresses from A to Z. It's useful for rare disorders, as you can imagine, because even if you want to do a national level survey, it could be a waste of money. It may not be easy to create participants, but you could find one case that you can explore deeper and further. The only weakness about case studies, as you can imagine, for epidemiological studies, is that you cannot attribute causal inference using finding from case studies. So you cannot rule out alternative hypotheses because you have not spoken to as many people. And if you're going to speak to 1,000 case studies, you better convert that into a different study design. So as you can imagine, it becomes very different to attribute causal inference to case studies. Correlational, as the word suggests, the term suggests, is really looking at the direction of relationship between X and Y, or two factors, or two variables, or two things that we are measuring in individuals. For example, does age correlate with depression? We have seen from the slide on the trends in the age groups that depression is higher in younger people, is stabilized within the middle-aged population, but it increases towards the end. You can answer that question using correlational studies. The only weakness, again, and there could be others, that you cannot determine which one comes first. So which one is the cause, which one is the effect, because these are mostly cross-sectional studies and they do not establish the temporal relationship between one factor compared to the other. I'm sure for the epidemiologists in the room, you're feeling like I'm preaching to the converted, but I'm sure for some people this is perhaps useful to understand that in these three forms of studies, we then see that the experiment approaches is perhaps the most important, the most useful research method, because you can determine causal relationship between one factor to the other. And usually these are either designed as randomized clinical trials. They consider they are perhaps longer, they are implemented over a longer period, and they can measure which one came first between one variable compared to the other. In other words, the cause and effect. So there are three features of a disorder really that we may be preoccupied with, that will define how we want to to design our study. So it's either prevalence or incidence of the problem or the risk factors around that problem. And if you want to know how to intervene for an risk factor for a problem, say depression, then you have to design a study in a way that you can effectively do that. And really, the import of this is that this really could be some of those proposals, some of those study designs that will be included within the proposals at the very end. The multidisciplinary proposals could include all this together or one of the most strongest study designs. I'm not saying that these can be done separately. I mean, within any experimental project, you could actually have case studies, perhaps. Within any cross-sectional study, you could have case studies embedded in them. So the concept of mixed methods in research is really stronger and perhaps a better approach to doing things than looking at these things in silos or independently, as it were.